Hi, everybody. I've met everybody already, haven't I? Um, I'll be brief about this because my story is just like each person's here, very convoluted. Um, in 2015, in the spring of 2015, I was about to do a 10K race, and I got a phone call from a medical secretary who said that I needed to get retested for a blood test. So I'm going to back up a little bit about that. I had a kidney transplant, my second, when I was 27 years old. Don't do the math. That was more than 30 years ago. Don't do the math. So I am what is known as a proactive patient. I eat well, I try to exercise, and so I'm one of the longest transplant recipients, as far as I know, in Canada. I was in the 30s, and healthy, fit, active lifestyle, etc. That entails, as part of the follow-up for transplant patients, I don't know if there are any transplant patients here. Are there? No? Monthly blood work for the rest of my life, as well as immunosuppressives, which means the immune system is not quite the same as a regular person. Anyway, I had managed that very well for, like I said, over 30 years. And with the monthly blood work, if there was ever an anomaly, any change, anything over the years, I would get a phone call within 24 hours saying, something's off here. You had too much pizza, or were you drinking last night, and so I would be retested, and usually everything would go back to normal. I'm sure you're aware of the magic word for your kidney, creatinine. For me, it's creatinine. For you, it's creatinine. Well, the phone call that I got that day in the spring of 2015 was, we think you probably ate something or drank something or you're stressed. Come in. It sounded just like it had happened every so often over the 30 years, like Christmas, birthdays. And so I was just about to hang up the phone, and then I realized it wasn't 24 hours since my blood test. It had been 3 weeks since my last blood test. So after asking a couple of questions to the receptionist, who was the substitute receptionist at the clinic where I get my blood work done, I learned that my creatinine had been creeping up for about 5 months. I was not impressed. I was scared. I had only one kidney. I did not want that kidney to be messed with. And so through asking a couple of more questions, always as a very annoyed patient, like, what a bad receptionist, I learned that I needed not only to be retested, but that I think I needed to ask some more questions. So I got retested. My creatinine was elevated. I called back my doctor, my transplant specialist, actually, who is also a nephrologist, and said, there's something off here. Why did nobody call me? Why didn't we know before? And I was really quite rude. But I was annoyed. I was not scared. I was just annoyed. And so the head of that unit said, well, what do you want us to do? And to which I replied, me patient, you doctor. What do people usually do when things like this happen? And they said, well, would you like an ultrasound? And I went, that sounds good. Okay, let's do that. We just have to figure out what's wrong with me. I felt perfectly fine. I really did. As I said, I was ready to do a 10K race. I mean, and I'm in my 60s. That's no small feat, you know? So the ultrasound showed that I had a mass. The CAT scan showed that it was a tumor. Long story short, I was told that I needed to get rid of that because it had gotten quite big. And because I had only one kidney, it looked like I was going to be losing the only kidney, which meant I would be on dialysis for the rest of my life, or I might die in the process. I didn't take that well. I I'm pretty sure I was close to being suicidal. I had been on dialysis for years before I'd gotten the transplant. I know the lifestyle, I know the situation. So it all sounded very bad, but here I am talking to you. So what happened? After I got mad and got scared, and you know what all those feelings are. I'm sure you've been through them in one way or another when you get this kind of a diagnosis. Mine was a little bit different. Because I had a transplant, because I was already immunosuppressed, because I'm not 21, it didn't look good. That tumor had grown to 5.5 centimeters in my one and only transplanted kidney. So the odds were. I was told I had 1 chance in 10 of surviving, even if I did get the surgery. I didn't like those odds. So I did a very bad thing. I went to the computer. You know how they say, don't go to Mr. Google? I felt I had no choice. So I went to Mr. Google, and for about a week, and I was still fully employed at this time. I don't know how I did it. I'm sure I was on automatic pilot the entire time. For a week, I researched everybody, everything, any name that had doctor in it, anything in the computer that said the word cancer. And then I realized I needed to be more specific. Kidney cancer. And then I found, and I'm not even making this up, Kidney Cancer Canada. I thought, I've never heard of them. What do they do? Oh, really? They can't be as good as America, you know. So I looked through it. I saw a lot of words that I had now become quite accustomed with related to Kidney Cancer Canada. I knew which stage I was. I knew some of the numbers. And then I saw a list of doctors that were uro-oncologists. Both of the words together in the same name, in Canada. I am forever grateful to Kidney Cancer Canada's website, because no doctor, no nephrologist, no urologist, nobody had told me about Kidney Cancer Canada. And as I stand here today, I'm telling you, it saved my life. On that list was a certain Dr. Ricardo Rendon, who happens to be here in Halifax at your hospital. I desperately begged my doctor to ask him to see me. And I know how busy you all are here, and I know how busy all doctors are. And I got a referral. It was sent. I called every day to the poor receptionist here, Dr. Rendon's receptionist, saying, I know I'm from out of province. I know he doesn't see me, but the clock is ticking. I really could hear the clock ticking, because we didn't know how long the tumor had been growing. From the CAT scans and other tests, we knew it was growing very quickly, and I have only 1 kidney. So they got a cancellation. I came for a consult. A month later, barely a month later, I had an open partial nephrectomy. Do you know what that is? Where in the kidney, they cut out the tumor, but whatever's left of the kidney, hopefully there's enough left over so that the patient can live. Well, here I am, living and functioning on less than 20% of 1 kidney. And I am, as we speak today, 2 years and 10 months cancer-free. And I must tell you, Kidney Cancer Canada, and of course, Dr. Rendon, and one other person who happens to be in this room, my social worker, John Thompson, was the other guiding light that I don't know if many of you have considered when you're thinking about how to cope with kidney cancer. He was a stranger to me when I met him. I had this thing in my head that social workers are only for the really poor people or the really dumb people, and I don't need one. And he held my hand and my sister's hand and any of the staff that I was driving crazy while I was thinking I was going to die, because I wasn't as polite as I am now, as you can possibly imagine, between the drugs and the fear. And John, my social worker, was my conduit. He was my connection to the nurses, to the doctors, to my family, to my job. And when I was unable, unwilling, couldn't concentrate, was too drugged up, was too scared, to try to keep that other part of my life that wasn't medical in any form. It just wasn't part of my thinking. He helped with that. That's what social workers do. So if I can leave you with a few thoughts about your own patient advocacy when you or somebody you love has kidney cancer, don't be afraid to ask questions. Sometimes no really is no. In my case, it didn't turn out to be that way, but there's always more that you can learn and understand. And if you don't understand what your urologist says or your oncologist says, ask a question and keep asking a question. Doctors aren't gods. No offense to the doctor in the room. They are wonderfully skilled, busy, focused, have to have a certain type of mental attitude to do their job. But nobody can do all the jobs. But that's also you. There's many things you can't do as a patient. There's many things you can't do as a family member of somebody who does have kidney cancer, but everybody can ask a question. And if you don't understand, say you don't understand. And if you're scared, have somebody with you. I was lucky enough to have my social worker and my sister. Some people don't have that, but you can always get a social worker. Even if you don't have the husband, the spouse, the best friend, the sister, the brother, the whatever. If you need help, it's there. Ask questions. Find a social worker who can help you with the things that aren't necessarily medical, but maybe financial, job-related, connection-wise. And believe when your gut tells you there's something else that they're not telling you or that you need to know, ask the question. It could save your life. It did mine. Thanks very much.